I am here at ASN Kidney Week with Secretary Alex Azar. Mr. Secretary, thank you so much for joining us here at the meeting and for your remarkable leadership on behalf of the 37 million Americans with kidney diseases. I understand you have a personal connection to kidney health, which you've spoken movingly about just now in the President's address. Can you please share for our community how your family's experience has motivated you to help transform kidney care in America?
Sure. So my father, actually, who's a very prominent ophthalmologist and was an adjunct professor at a major academic university also, went into end-stage renal disease, and frankly, it was caught rather late. So we weren't able to intervene as he progressed through the phases of chronic kidney disease. Went into end-stage renal disease, and like so many, went right on to center-based dialysis. So I got to see as a family member and caregiver the impact that center-based dialysis can have. You know, thank God for it. If we didn't have it, it's important, but it's very draining. You know, I can just speak from personal experience, having seen that going in the several hours one spends in the clinic, it's physically so draining on the individual. You come back home and then you spend the next day recovering, and then it's time to go right back in and be drained again. So is it any surprise that so many people suffering from ESRD end up being disabled and unable to continue to be productive in the workplace? I saw that firsthand. Well, then he learned about home-based peritoneal dialysis. So got the port installed and just had a terrific experience with working with the vendor to get that established at home. And then while sleeping, able to be dialyzed and wake up in the morning still refreshed and just on a steady basis. So that really was a life changer and perhaps a lifesaver. And then we ended up, a gentleman in our small town in Maryland, and this has been written about publicly, he knew my father but not well, and he said to my dad, I'd like to give a kidney for you. And it ended up he wasn't a match, but he still gave into the system through the directed donor program, and so he gave a kidney that went to an individual, and at the same moment a matching kidney was transported and transplanted into my father, and he had done very well for a considerable period of time. But I've also then been able to see the struggles of post-transplant, how much of a challenge it is for patients, especially senior citizens, in the years after they're transplanted. So I've actually personally gotten to see the entire continuum of care from chronic kidney disease through transplantation and post-op, which probably is pretty unique for a health secretary.
Well, I hope that your father is doing as well as he possibly can post-transplant. And I think you've nicely highlighted some of the major challenges that kidney patients face, from early identification opportunities being missed to finding the right modality, and what a challenge that can be. I think that's a nice transition to talking about the framework that President Trump put into place this July through his executive order. Can you walk through for our viewers sort of what that looks like and what its three main goals are?
Yeah, so as you mentioned, there are three key elements to it. The first is, let's see if we can stop the progression of chronic kidney disease. Let's not assume you go right to end-stage renal disease and kidney failure. Let's actually get people into the system early on and slow or stop that progression of chronic kidney disease. So why do we end up with so many people going right to dialysis? I'm sorry, but you get what you pay for. Our system pays for center-based dialysis. We get center-based dialysis. The president's going to change that. We're going to start paying for stopping the progression of chronic kidney disease, early intervention. We've got an important partnership with the National Kidney Foundation and the American Society of Nephrology that I just signed on Monday, that's going to be a critical part of educating patients and family members to get at that, identify chronic kidney disease early, get at that early, and get in to see somebody right away, and then pay those who are involved in dialysis and nephrologists for managing those patients better and stopping that progression. So that's phase one. Phase two is, in America, so many of our patients go right into center-based dialysis.
Just like your father experienced.
Yes, and you know, the outcomes are worse. If you start center-based and switch over, it's going to be worse than if we can get you right onto home-based dialysis. And so in America, over 80% of American patients, their first experience with dialysis is center-based. In Hong Kong, that's completely reversed. Our peer country, completely reversed. So we're going to pay. Again, Right now we pay for center-based, we're going to start paying for home-based dialysis for patients. Flip that over. We're also investing heavily with the American Society of Nephrology and others in Kidney X, which is for new technologies on dialysis, artificial kidneys, other ways that we could treat patients. Third key element of the program is transplantation. Get people to transplant as quickly as possible if they need a transplant. So we're going to double the number of kidneys available and transplanted. So that's going to involve both the work that we're doing with ASN and NKF to increase awareness, to get people to think about kidney donation, but also we're going to work on increasing the accountability and metrics for our organ procurement organizations to make sure we get more usable kidneys and get the transplanting surgeons willing to use more of these usable kidneys through good metrics and transparency.
Well, it's a remarkable, comprehensive framework that I think really hits on each of the long neglected unmet needs of kidney patients. And we at ASN couldn't be more enthusiastic about working in partnership with you and the administration to enact all of these changes on behalf of kidney patients. So thank you for your leadership, Secretary Azar. Are there any concluding remarks you'd like to give reflecting on the executive order and the work of implementing that you and your team are leading moving forward?
I would just emphasize that what we're doing in kidney care is doing something for and with kidney patients, not doing something to kidney patients. Kidney patients have been acted upon for too long. Well, President Trump has a vision of healthcare that puts the patient at the center. Personalized, affordable, patient-centric health system with you, the patient, in control, that treats you like a person and not like a number. And that's what we're orienting this whole approach around, is that vision of the patient in control and at the center. So we're working with patients, working with NKF, working with the providers through the American Society of Nephrology and others, working with industry. We actually have the cooperation and partnership of industry to completely change the business model from this one that's based on center-based dialysis to early identification and prevention of the progression of chronic kidney disease, to moving to transplantation if possible, and moving to home-based dialysis if necessary. So I'd say this is a very collaborative, cooperative effort, one that frankly in my 20+ years in healthcare and government is unprecedented.
Well, we appreciate the opportunity to collaborate with you all, HHS, in an effort to achieve these ambitious goals that the President and you have laid out. So thank you again for your leadership, and we look forward to the continuous improvement on behalf of the 37 million Americans with kidney diseases.
Great, thank you, Rachel.
Thank you, Secretary.